Welcome to Senior Strategies, Tools for the Caregiver with Amy Decker and Shayne Silver. Join us on each show where you're going to enjoy a lively conversation that's going to connect you to the tools and resources that you'll need to coordinate care for the seniors in your life. We are so happy that you joined us. Hi, welcome to Senior Strategies. I'm Amy Decker, and I am Director of Client Services for Senior Helpers in South Palm Beach County.
And I am Shayne Silver with the Silver Team at Keller Williams. I am a seniors real estate specialist, and I am a caregiver.
And I don't know where you live, but I know in this area that we have right now, it has been raining nonstop.
Yes, it
nonstop.
Is.
We
it
have
is.
flood alerts for what's going on. So getting here, and thank goodness we didn't straighten our hair.
Thank God we didn't.
Because
Pearl
we've
power
got some
today.
crazy weather going on, but it's supposed to get a little bit cooler.
I'm hoping for cooler weather, hence the scarf.
Yeah,
We're getting ready to celebrate Thanksgiving,
Yes.
so I'm hoping that it will cool down a little bit.
Right. But it was hectic getting here.
Yes.
And we're happy that we're here, and we're happy that you're here.
And thank you for joining us.
Yes.
Thank you for joining us. We have an exciting show today.
Mm-hmm.
We have with us today Dr. Patel, who is a local neurologist with the Brain Manners Research Center.
Mm-hmm.
So we're excited to talk to her a little bit later. But I wanted to talk to you, our viewers, a little bit today about caregivers in the workforce. I came across something really interesting this week.
So good.
And this was a letter, actually, that was put out by Jim McCann, who is the CEO of 1-800-Flowers,
Mm-hmm.
who also owns Harry and David. Mm-hmm. And I really wish that more, and I hope that more large companies would follow suit. So last November, he sent one of his employees to a caregivers conference with the goal of finding out what our company could do to support the millions of people who provide care to their elderly parents, their ailing spouses, their friends, and loved ones. Basically, family caregivers. Mm-hmm. And according to the U.S. Census Bureau, they predict that by 2030, there will be 73 million caregivers in the workforce. That means they're caregivers and they're working a part or full-time job in addition to that.
And what I thought was interesting is he sent Rhonda, which was his employee,
Mm-hmm.
and she went to the conference thinking she was going to glean information of how
Right.
to care for, for people that they work with. And then she realized after sitting there and hearing stories from other people that she too was a caregiver.
Yeah.
She had
didn't
no
even
idea.
realize that. And we talk about that all the time.
Most people have no idea that they are a
Right.
caregiver. They are just struggling caring for somebody,
Right.
but not realizing.
If you are caring for a parent and you're taking them grocery shopping and
Right.
you're taking them to doctor's appointments and you're helping them set up their pills, I hate to break it to you, but you are a family caregiver.
Yeah, if you're taking time off work to go, instead of working to go take care of them, you are a caregiver. And Shayne, you would know this.
Yes.
That's
That is
you.
the story of my life.
Yes.
However, I think it's great what came out of this. So he went in saying, what can we do as a company? But when she came back and she said, oh my God, I'm a caregiver, they looked at all of their companies and all of their employees, and they found that they had so many family caregivers as employees that they turned it around and said, what can we do for our employees to make this a more caregiver-friendly environment?
Because they weren't realizing that people were giving up hobbies, they were giving up weekend jobs, they were taking time off work to struggle in that journey of being a caregiver. And companies, in most cases, just had no idea that that's what they were doing.
They had no
and
idea
why.
that that's why their staff was taking off. They thought maybe they were going on a vacation. They didn't realize it.
Yeah, and I think the thing that was most interesting to me is when you go to have a baby, you have 9 months to think about it,
Right.
but you've got time to
You have maternity
prepare,
leave.
and you get maternity leave. When you have to care for a senior, a lot of times it's plopped in your lap. You don't have 9 months to prepare for it, and now you got it. Now there it is, and you don't get time off for that.
I have a friend going through that right now. She was caring for her mother and her father, and her father ended up in and out of a hospital and a rehab for about 6 months, and she's a teacher, and she had to take FMLA leave to get time off from her job.
And that's no pay.
And that's no pay. And granted, she is a teacher, so it's a little more, it might be a little bit more difficult.
Yeah.
But often when we're thrust into caregiving, that's exactly what happens. There's no 9 months to plan. We don't know that our loved one is going to fall and break a hip and we're going to need to be there by their side.
And that's what this one couple said that they interviewed. He said, elder care is not planned in most cases. It's not planned in most cases, and it can have devastating consequences. So they, in fact, this other couple quit their jobs, quit their full-time jobs. They weren't prepared to do that. To care for
their loved ones.
To care for their loved ones.
And that's what a lot of people end up doing. Either they have to quit their job or they have to leave it and find a part-time job or a job where they can work from home and be more flexible. And that's one thing that this Jim McCann did.
So commendable.
He took all this information and he created a resource group within the company for any employee that was a caregiver. They formed a support group, just like we have, and we've talked many, many times.
They're so important. They're important to those that are attending. They're important while you're there, that you feel like you're helping somebody else. So you might come with a broken spirit, but now you realize you're able to help somebody else, and now it makes you feel better. And by the way, our support group is this Thursday at Allegro at 3 o'clock in Boynton Beach on Hagen Ranch Road.
There's so many benefits. You know, we've said before that caregiving could be very frustrating, it could be very sad, and it could be very lonely and isolating. And finding that support group where you see that there are other people going through what you're going through, and you see that you're not the only one, and you can learn from other people. So that was the first thing they did. And they created a resource center within their HR, I think it was. They created a resource center to let caregivers know, look, there are resources available for you, things that you might not know existed, or a way that the company can help, or other local resources. And they are looking at some of their policies and what they can do to improve the workplace. Maybe it's more flexibility with flex time, creating this support community.
The support community, and it says also they were encouraging conversations among caregiver employees. So they would bring them in and talk to them, and how are you doing, and how are things going, and do you need time off? And so they were proactive with their employees, not waiting for them to come to them, but making sure that they know they have the support that they need if they did need to take some time off.
And we know too that when you're caregiving, your mind is elsewhere. You're not as focused. And I think with employees start to realize that once the needs of their employees are met personally, they can focus more at work, right? I know that if I'm worried about, I got to leave early today because I have to take my dad to the doctor, part of my day is focused on that, and not necessarily being as productive as I should be in my work. So I think if we can meet some of those needs in the workplace for our caregivers, they will be more productive.
Yeah, and like we've talked about before, very often they don't want to burden anybody with their problems. They don't want to burden people with their stories. But yet if you go to them and encourage that conversation, they're able to purge that.
And make that a safe space for them to do so, where they're not worried that they're going to be let go or fired, or someone's going to say, you were out 4 days last month. How do we correct this behavior? Well, I'm not out on vacation. I'm actually out because my mother's sick, or I had to accompany them to the doctor. So maybe creating that flex time, but really creating a safe space and resources within that company. And I really want to commend him for doing that.
Because living with guilt and fear constantly, fear of missing a phone call from your parent, fear of having to take a day off work, feeling guilty that you're not answering a phone call from your parent, feeling guilty that you've got to take some time off work. You're never going to be productive in any part of your life.
Have to hide in a closet to take that phone call from your mother's doctor or something like that.
Right. So encouraging conversations and like you said, giving them a safe space. And what a great idea. And we know November is Family
Caregivers Awareness Month.
So it was perfect that this came out and we were able to share that.
And also, please, if you haven't already, please visit our Facebook page or our Instagram, and you will find many facts and resources pertaining to Caregiver Awareness Month.
That we've posted all week.
Yes, we've posted all month, so you can find some statistics, you can find some resources. If you're looking for something that we have not posted there, please, as always, feel free to reach out.
And leave us a message.
And
now we're going to take a commercial break, and when we come back, we're going to be speaking with Dr. Patel. She's got lots of things to share with us.
Join us after the break.
Welcome to Allegro Boynton Beach, the epitome of luxury senior living. Discover a lifestyle free from maintenance worries, or experience gentle support tailored to your daily needs. Choose from our exclusive offerings of independent living, assisted living, and memory care, each designed to provide a personalized experience of utmost comfort and care. Indulge in a maintenance-free retirement or embrace the support you deserve. Surrounded by the finest amenities and compassionate staff. At Allegro Boynton Beach, luxury meets a vibrant community where every moment is filled with joy, purpose, and peace of mind. Experience luxury senior living at its finest. Contact us today to schedule your visit and discover the unmatched lifestyle awaiting you at Allegro Boynton Beach.
You love your mom and dad, and they've always been there for you, always taken care of you. But now they could use a hand, and sometimes more help than you can provide. Thankfully, there's Senior Helpers. Experts in Alzheimer's, dementia, and Parkinson's care. We can help you transition from a hospital stay to home, or just help your loved one with assistance with their everyday needs. Visit seniorhelpers.com to learn more. Discover why Senior Helpers is senior care, only better.
Are you considering selling your home? Are you considering downsizing? Are you considering a transition to an independent or assisted living community? Are you considering moving to be closer to your family? Do you need a home more conducive to aging in place? If so, you want to talk to Shayne Silver, co-host of Senior Strategies and Senior Real Estate Specialist. Shayne and her real estate team are extremely knowledgeable and experienced when it comes to helping seniors and their families make life's important transitions. Shayne will guide you every step of the way, making the transition as stress-free as possible. To schedule a no-obligation consultation, call 561-735-3030.
Welcome back to Senior Strategies with Amy and Shayne. Coming up next are more tools and resources you will need to make your journey of caregiving a little easier. For more information or to be a guest on the show, please contact us at 561-800-6654. And now, on with the show.
Hi, welcome back to our show. We've got a great guest.
Yes, I'm so excited for today's
And
show.
we, in between commercials and even before and after, had a ton of questions for her. So I hope that we remember everything that we talked about, because
Yes.
it was very interesting what her responses were.
Yes.
But Dr. Patel is a neurologist specializing in cognitive disorders, including dementia and neuropsychiatry at the Brain Matters Research. She's also a member of American Academy of Neurology and a board member of Alzheimer's Research Care Center. She completed her fellowship in cognitive behavioral neurology at the Cognitive Neurology and Alzheimer's Disease Center at the Northwestern University Feinberg School of Medicine in Chicago. And she's been practicing medicine since 2008. So we're really excited to have you.
Welcome, welcome.
So tell us a little bit about yourself and how you found interest in this field.
So I found interest in this field a long time ago as a medical student, actually. When I saw my first patient with multiple sclerosis, and that patient had bipolar disorder, and I thought, what's the connection here? And that's when I started to realize that different neurologic disorders were associated with psychiatric disorders as well. And so it was kind of interesting, because we're in a time where I feel like there's a separation between the brain and the mind. But that example led me to realize that these circuits are all connected, and the brain and the mind can't be disconnected. They're one and the same. So that's where my interest in memory disorders developed. And then I started my fellowship at Northwestern, and we saw many patients with Alzheimer's and specifically unique dementias, like primary progressive aphasia and frontotemporal dementia. And that just continued to pique my interest, and I've never looked back ever since.
That's great.
I like working with the elderly. I like being able to do something to help them. It's my passion.
And we're finding even in the field now with celebrities, Bruce Willis coming forward with what he has and the different forms that even Bruce Willis's wife is really working on making this an educational thing. So all of us understand, because, in the past people would say, oh, they have what did
They have Alzheimer's.
but they
not
called it
realizing.
something else. They called it,
Senile dementia?
Yes.
Senile.
Oh, they're senile. And they don't know what they're talking about. Well, then it became younger and younger and younger people were getting this. So now we're looking more into it. And so it's people like you that probably are filled with information of, you know, who do you see more of? Like, what is the biggest?
So it's funny because that leads me to a question that gets commonly asked, which is what is the difference between Alzheimer's and dementia? Which leads me to what I call the dementia umbrella.
Yep.
Underneath the dementia umbrella fall different types of dementia, and Alzheimer's is the most common type of dementia, or most common type of mild cognitive impairment, especially above the age of 65. After that, then you have vascular dementia, Lewy body. There's a debate as to what's second and third, but Alzheimer's by far is the most common form of dementia.
And is that just dependent on which section of the brain gets affected
Plaque
first?
Yeah.
Well, so it has to, yes and no. So part of it is distinguished by the location of the brain involvement, but part of it is the pathology. So just simply put, with Alzheimer's, you've got amyloid plaques and tangles, which are the abnormal pathology. With Lewy body, you have Lewy bodies that deposit themselves. Then you've got in both the cortex and then the movement disorder, the movement centers of the brain. So you kind of get a dementia plus a Parkinson's type of a presentation, for lack of better description. And
Sorry, go ahead.
no, that's okay. And then you've got vascular.
Right.
And vascular changes are essentially tiny little subclinical infarcts that are just so tiny individually that they don't present with symptoms, but collectively over time accumulate and can cause cognitive changes.
Which is what my aunt had, and they were thinking it's because she had open heart surgery, and then after she got home, she had fallen down the steps. So
Yeah.
hers was vascular. So dementias can be something that's genetic, but it can also be something that's
Yet. And then the majority of dementias are actually not genetic. Or genetically acquired, rather. Interestingly
good.
enough,
Yeah.
I mean, there are risk factors. So we'll go in, I guess, and go into one risk factor later on. The ApoE gene is a risk factor,
Right.
and having a specific type of that gene can increase risk. But at the same time, you can have 2 copies of that risk factor gene and not develop the disease. So it's not the only thing that serves as a risk factor for Alzheimer's.
which causes a lot of people to go to the study groups, which Shane did.
Which I did. And I was told that, and we've mentioned this before on the show, that I was told that I am a carrier of the ApoE4 gene, and what exactly that means, right? And that's all I was told. I wasn't told anything kind of beyond that. And what I'm learning here today is that there's more to it than that.
Yeah, there's more to it. So that increases your risk from the general population risk from about 10 to 15% to about 20 to 25% roughly, based on studies out there.
And that's a blood test.
It's a blood test.
Okay.
Yes. And actually, I apologize. So she had 2 different tests. So she had a plasma amyloid
Right.
test as well as an ApoE gene. The ApoE gene is a swab of the mouth and of the mucosa. And so the important thing to note there is that you have either 1 or 2 copies of the gene, which can increase your risk. If it's 1 copy, it increases risk to about 20 to 25%. If it's 2, it increases it to about 30, 35%. But it doesn't necessarily mean you're going to develop the disease. It's just a risk factor. And I think it's important to keep that in mind because the focus nowadays is prevention of symptoms. And so when you're looking at prevention, you want to look at your risk factors. We know that amyloid plaque in the brain forms maybe 20 years ahead of symptoms. So if that's the case, then we want to look at all of our risk factors and modify as much as possible. And after that, it's kind of a crapshoot. You hope for the best and prepare for the worst is what I tell my patients.
I'm a big believer in there's only so much that we can control. So why not control what you can, right? I know diet, exercise, getting oxygen, keeping your brain awake using brain games, using Sudoku, whatever it is. My mom used to do the word searches and the Sudoku puzzles. All of those things are risk factors that I can control. I can eat right, I can exercise. There's so few that you can control, so why not do what you can, right? Because as she said, there's a lot that I can't control. I can't control the plaque. I can't control my genetics.
So then at one point, so you're healthy, you're eating right, you're exercising, everything's great. At what point then do you feel that someone should go see a neurologist or go to one of these study groups? What would be going on in their life at that time that they should reach out to you or to go to one of the study groups?
Good question.
Yeah, that's a really good question. So
Good question.
we have to look at the differences between normal aging versus mild cognitive impairment. And it's really important to know that some changes occur as early as our 30s. Sorry for our younger viewers out there. So decrease in concentration, multitasking ability, those types of things start to decrease very gradually and slightly in your 30s. And then like you hit your 60s and you start to hit that, a lot of seniors out there are going to be able to identify with this, that tip of the tongue phenomenon, where you know what you want to say, it's on the tip of your tongue, and it just won't come out. And that's also a part of normal aging. So it becomes kind of tricky to know, like, okay, is this mild cognitive impairment or is this normal aging? And so, the red flags for me for mild cognitive impairment, and there are many, but a few that I'll share with you today are when there's a safety issue, particularly with driving, scamming, leaving the stove on, that kind of a thing. Specifically when there's involvement of daily activities and impact on daily activities where the memory or cognitive changes are affecting your ability to do things independently. And then, there are a whole bunch of other slew of things, but
And you said
losing
scamming.
things, scamming, yes.
So like what? Meaning they're falling for people calling on the phone to say, hey,
Send me money.
send me
Yeah.
money, or
Yeah.
okay.
I am really glad that you said the whole tip of the tongue thing is normal aging.
Yeah.
Because that is something I experience a lot where I can't think of a word that I'm trying to use in a sentence. And I know it's because, as Amy has told me, if you compare your brain to a computer screen, you can only have 5 tabs open at
Right,
a time.
right.
And I'm probably doing way more than 5 things at a time. And I hope that that's all it is, because there are times where I'm like, I can't think of that word.
Yeah,
And
there's Teepa Snow
drives me
said
crazy.
5 to 7. You can have 5 to 7 windows open, and then stuff starts falling off. Which is why you walk into a room and go,
what was I here for?
What am I doing here? Yeah,
Right.
and you got to go back, sit down, and then go, oh yeah, that's right. I do that. I think every day. But again,
Yeah.
people probably go to you and say, should I be concerned?
All the time. All
Yes,
the time. I think
yes.
most common complaints are, I'm having trouble finding a name, I'm having trouble finding a word, or I went into the laundry room and I completely forgot why I went there. But those things aren't necessarily concerning to me. It's when they're completely forgetting a recent event or a conversation.
Right.
Or there's, like I said, safety issues involved, or we're losing valuable belongings.
Yeah.
It's not just about misplacing something, because you can track your way back to it and that shows good memory, right? But when you're losing something that's valuable to you, your phone repeatedly or your wallet, those are red flags to me. And the honest truth, the simple answer to your question is, if there's any kind of concern whatsoever, it's good to get evaluated, because we know that this pathology for Alzheimer's starts many years ahead of symptoms, up to 20 years.
Wow.
So
Yeah.
if you're concerned, at the very least, you can get a baseline. And if there were to be a change later on, at least we have something to compare to.
And how do you get a baseline? What do you do to get their baseline?
So, you can get a baseline through either a private neurologist or centers like Brain Matters Research. The nice thing about what we do through research is everything is confidential. Everything is paid for by our pharmaceutical sponsors, so we don't even take insurance information.
Wow.
Which is nice, because when we're looking at these cutting-edge biomarkers, these blood tests specifically, amyloid PET scans, which cost $3,000 to $4,000 out of pocket, you can get all of that workup for free.
I'm calling tomorrow.
Okay,
I'm
so
making an
speaking of
appointment
that,
tomorrow.
calling tomorrow, if somebody wanted to call you tomorrow and set that up, what number would they want to call?
So they would dial 561-374-8461, and they would ask for a recruitment department and basically ask for a No-Win90 free memory screen. So
Say
that's
that again.
It's 561-374-8461.
And they want to ask for a,
Ask for recruitment to ask for a No-Win90 free memory screen.
okay.
Yep.
I'm calling tomorrow.
Yeah,
Yep.
honestly, it's good to know that you can do all that. So you'll start, that's how they get their baseline.
Let me back up
Go
one
ahead.
second. So
Yep.
we talked about how dementia is an umbrella, and there are different types of dementias. And when it comes to getting a diagnosis, is it important to know which type, and does that affect treatment and the type of treatment?
Yes, very good question. So, so we are one of the largest private centers in the United States focusing specifically on Alzheimer's disease. Every so often we have a study for other types of dementia. We had an apathy study recently for Lewy body dementia, frontotemporal. But mostly our specialty is Alzheimer's. So in order to qualify for these Alzheimer's studies, we have to rule out other diagnoses, and sometimes that's done by a private neurologist. or PCP, where we're looking at, labs, looking for common fixable causes. Maybe an MRI has been done previously. Maybe you've had formal cognitive testing done before, but it's not a requirement to come to us to screen.
And what's a fixable cause? So like a UTI?
Yeah, like
So
UTI.
someone could have a UTI and they
you
get
can
concerned.
show-
Yep.
What are other fixables?
Great question. So
Yeah.
thyroid disorders come up very commonly.
Okay.
Hypothyroidism, hyperthyroidism, or even Hashimoto's, where you can be euthyroid, hyper, or hypothyroid,
Oh,
depending
wow.
on the phase of
Yeah.
the disease.
Right.
It's not really as commonly diagnosed, although I truly believe it's underdiagnosed. That's my personal opinion. But other common fixable causes would involve B12 deficiency, sometimes vitamin D deficiency, which, believe it or not, we live in sunny Florida. You would
Right.
never expect us to be deficient.
And most of us are.
and
But most of us are at least either insufficient or deficient. So, yeah, those are common causes. And then the MRIs can be helpful if we're looking for any structural issues. Sometimes we have a benign tumor of the brain, like a meningioma, which can be corrected. So there are fixable causes, but when we're looking for eligibility for a prevention or treatment study for Alzheimer's, we're looking for a biomarker consistent with Alzheimer's disease pathology. And that's usually either the amyloid plaque or the tau tangles.
And you can also do the test. I'm not sure if an MRI shows that, but I know one of the things I learned through the Teepa Snow Gems course is the brain actually starts to atrophy and pocket holes. And so often when you tell somebody, what time are we having dinner? Well, it's
Right.
at 4:30. Well, what time are we having? It's at 4, because it's going in the hole, so they can't retrieve that.
Yes. It's specifically a retentive memory loss.
Scary.
Right.
So it's because memory loss can be caused by all different kinds of things. Like you mentioned, a common cause, like stress can cause that when you
Right.
have too many tabs open. And with, now in this day and age where you have so much background noise and distraction, like the emails are
Right.
flying in, the phone's ringing, somebody's asking you a question while you're on a headset.
Right.
These are distractions. And when you're having trouble remembering information, sometimes it's because you're not able to retrieve it correctly, or you're not
Right.
encoding it correctly.
Or you're not even hearing it correctly.
Right.
I'm
Right.
cooking dinner and I got the TV on in the background and my daughter's asking me a question and she wants me to look at her homework and
And I'm
next
calling
thing
her
I
on the
know-
phone saying, hey, I got this great idea for the show.
And next thing I know, I got 87 things going
Right.
on.
Right.
It happens, and I think that sometimes that scares caregivers too, because
Yeah.
here are these caregivers that are caring for their loved ones, and all of a sudden, like me, I'm like, oh my God, I can't think of a word, and that's what made me go get tested, because I was like, I'm only 50, and my mom was diagnosed at 69, which I think is considered early onset. And I was like, oh,
I'm
no.
in trouble, yeah.
I am in trouble. Like I said, there's no way I can't have it. My
Right.
mother had it. My grandmother had another form of dementia. I'm like, there's no way.
What's the youngest that you've ever seen?
Well, the youngest out there, I think, is under the age of 20. I want to say maybe 18 years old.
Really?
But the youngest that I've ever seen, probably 57, 55.
But what would cause an 18-year-old?
Well,
Would
these
that
are,
be a genetic thing?
Yeah, so this is like
Wow.
the 3% of Alzheimer's that is
Wow.
genetically acquired. So that was most likely a genetic mutation. Although it's a possibility that there wasn't, and it may have been sporadic. I'm not too sure about that one. But the majority of cases below the age of 65 for what we consider early onset are usually genetically acquired, and you see that through different generations consistently.
My grandmother didn't start seeing signs of it until she was much older. She was well into her 80s. She fell and broke her hip. She was under anesthesia for probably 8 hours.
And they do say
And when
anesthesia
she
does
came
that.
out, after that first surgery, we definitely started seeing cognitive changes, and the surgery didn't take. And 3 months later, she had to go under
and
again
that
for
did it.
5 more hours. And when she came out that time, she never recovered.
Yeah.
And and I don't know, to be honest, I don't know at that point what type of dementia that was. I know that my mother was diagnosed with Alzheimer's.
Well, we have lots more questions,
Yes,
so I
so
hope you're
much
ready
more.
for us. We're going to go to a commercial, and we'll be right back.
Welcome to Allegro Boynton Beach, the epitome of luxury senior living. Discover a lifestyle free from maintenance worries, or experience gentle support tailored to your daily needs. Choose from our exclusive offerings of independent living, assisted living, and memory care, each designed to provide a personalized experience of utmost comfort and care. Indulge in a maintenance-free retirement or embrace the support you deserve. surrounded by the finest amenities and compassionate staff. At Allegro Boynton Beach, luxury meets a vibrant community where every moment is filled with joy, purpose, and peace of mind. Experience luxury senior living at its finest. Contact us today to schedule your visit and discover the unmatched lifestyle awaiting you at Allegro Boynton Beach.
You love your mom and dad, and they've always been there for you, always taken care of you. But now they could use a hand, and sometimes more help than you can provide. Thankfully, they're senior helpers, experts in Alzheimer's, dementia, and Parkinson's care. We can help you transition from a hospital stay to home, or just help your loved one with assistance with their everyday needs. Visit seniorhelpers.com to learn more. Discover why Senior Helpers is senior care, only better.
Are you considering selling your home? Are you considering downsizing? Are you considering a transition to an independent or assisted living community? Are you considering moving to be closer to your family? Do you need a home more conducive to aging in place? If so, you want to talk to Shayne Silver, co-host of Senior Strategies and Senior Real Estate Specialist. Shayne and her real estate team are extremely knowledgeable and experienced when it comes to helping seniors and their families make life's important transitions. Shayne will guide you every step of the way, making the transition as stress-free as possible. To schedule a no-obligation consultation, call 561-735-3030.
Welcome back to Senior Strategies with Amy and Shayne. Coming up next are more tools and resources you will need to make your journey of caregiving a little easier. For more information or to be a guest on the show, please contact us at 561-800-6654. And now, on with the show.
Thank you and welcome back. We are Senior Strategies, and we are here today with Dr. Patel, neurologist with Brain Matters Research. We have so much more to discuss. That first segment just flew by.
Right.
So, Dr. Patel, what are some of the most asked questions
That are problematic situations.
Situations that you see with the Alzheimer's patients?
So a lot of the problematic situations, unfortunately, they revolve around behaviors. So we were talking earlier about an example of, I don't know if it's the person that you're caregiving for, but difficulty showering and patients not wanting to shower. And actually, that's kind of a specialty, and it's an area of interest of mine. It's not that we covered that through research per se, but we like through our research center to be able to help caregivers in a one-stop kind of fashion, because the last thing I want to do is to take a overwhelmed caregiver and send them elsewhere for things that I could give them tips on. And I still think, evidence seems to prove that non-pharmacological interventions are still the most effective for treating behaviors. So most commonly we get behaviors like agitation, resistance to showering, daily activities.
So what is your answer to that? So someone is resisting showering. What's going on in their body and in their mind that they don't want to take a shower, and what can we do to make it easier?
That's a great question. So I think the biggest thing you can do as a caregiver is to step inside their shoes. Step inside the patient's shoes and try to feel what they're feeling. There's a formal method out there, the DICE method, which is basically saying take a behavior, observe the patient in their natural environment, make observations as to what the triggers might be, so forth. Institute an intervention, and then reevaluate when you're done. And so with showering, for example, it could be a slew of things. Privacy is a big one. Sometimes patients don't like to get into the cold water. And so I've seen all kinds of out-of-the-box thinking, and that's where I'm going with this is there's no cookie-cutter solution for these behaviors. You have to look at the patient, and you have to do patient-centered care. And so a patient who doesn't want to shower, maybe they're cold, maybe you need to really warm up the temperature, bump up the thermostat, keep their clothes on and wet them first, and then kind of ease them into the shower.
So just put them right into the shower, put the warm water on, and start scrubbing them with their clothes on, and then slowly take them off.
Maybe just like slowly, integrate, or or it might be a matter of having a female do the showering versus a male, just gender differences.
And I think that something also was brought up to me this morning. I was talking to a friend of ours, Melissa Rapkin, who's a guardian, and we were discussing this because my mother, I'm experiencing this with my mother, and I said I'm going to have to start taking the time a couple times a week to go there and shower her myself. and she looked at me and said, do you think your mother wants you giving her a shower?
Right.
Right? Like,
Right.
they still want to have their
You want to be the
dignity.
daughter still. Right.
They still want to have their dignity, and I'm going to cry, and I'm still her daughter.
I know.
And am I the best person to do that?
Right.
Right? But
So sometimes a neutral party, a complete stranger to go in there and bathe her as a neutral party,
Right.
because she might not want you seeing her that
and
way.
it might be the water, and it might be the temperature. It might be that she's just forgotten the process
Right.
or how it works, or she doesn't remember that it's been weeks since she showered.
Right.
So that's hard too. But something that you said before, I think is really important for caregivers to really understand. Number one, there's no perfect way and there's no perfect answer, and it's going to be different for everyone. But number two, you have to pick your battles, right? So maybe I can't get her into the shower, but maybe I can get her to the hair salon once a week and they can at least wash her hair.
Right.
Right? So we have to pick our battles.
And that is even what you said as well, Dr. Patel. You have to
Always,
pick your
always.
battles.
Right.
So
Yep.
showers are a biggie. What's another one that people come to you and say, how do I fix this?
What are the caregivers not complain, but what are the
Biggest
caregivers'
challenges?
Biggest challenges?
Yeah.
Driving. Driving's a hot topic. Yeah.
Yes.
So, so-and-so is driving. What do I do? When do I know when to, relinquish that ability and so forth? That's a really hot topic.
And what's your answer?
It depends on each situation, but I think the most important thing is establishing a relationship with the caregiver and coming up with a plan ahead of time, because it should never come down to you can't drive anymore.
Right.
That's it. Right. I think that there are warning signs way ahead of time in order to try to kind of maneuver around the process. So with some caregivers, I'll say, listen, you're doing most of the driving right now anyways. Are there ways where you can kind of divert driving so that he's not having to drive creatively?
Right.
Like let's say he's getting together with his boys at the Dunkin' Donuts or whatnot. Can you have one of his friends pick him up? And say, hey, I'm driving past there anyways. Like, how about I drive? And just be creative about it without making it seem obvious that you're taking away
Right.
a driving ability, because especially for men, I find
their
they struggle with it.
Yes, that's the biggest problem. And I know a lot of the families that I talk to, they'll say, well, I'm going to get a diagnosis from his doctor, and you get that form that you fill out and goes to Jacksonville, and it says, okay, I don't know what comes back. You can no longer drive. Or
Yep.
You think that's really going to keep him from driving if that's his only way to get to Dunkin' Donuts and see his friends? Yeah.
My dad hasn't driven in 8 years, and I go there, and he's looking at cars on the internet. And there's no way he could possibly drive. None. He hasn't driven in 8 years. We took his
Right.
keys away when he moved in to the independent living because he had had a couple accidents. And he still thinks he's going to get
Well,
up.
it's
and
men-
he can't walk.
and it's just
He
men
can't
in their
walk.
cars. Oh.
Can't walk, but he thinks he's going to buy a new car and drive.
Yeah. Yeah.
And that's the thing. The state of Florida isn't going to take away your keys.
Right.
They're only
Or
going to
remove the
have you
vehicle.
turn in your license.
Right.
Right.
That doesn't mean you can't drive.
Exactly. And
Right.
that's where I think establishing a relationship with caregivers
Mm-hmm.
and coming up with a plan. Sometimes, as extreme as this sounds, you have to disconnect the battery. It has to be a
Yeah, we've done
non-working
that.
vehicle, and it has
Right.
to be removed from the scene. I mean, every scenario is different.
We've done the disconnect the battery on clients. We've also said, well, we have to bring it in to get the car serviced, and then
Yes.
the car's gone. It never comes
Yep.
back. So we've done that too. But again, it's really hard when you're dealing with, they're with it enough to know that the car's missing. They're with it
Right.
enough to know they don't want to take a shower. It's when
Right.
they're with it enough to be combative and still demand what their rights are. That's the hardest part. It's
That is-
difficult.
It is really hard, and I think the only thing I can really do to soften the blow sometimes is I have a very transparent conversation usually with the caregiver individually, and then caregiver and patient.
Yeah.
But I tell them that, look, you've entrusted me to protect you medically.
Right.
Well, now here's the financial legal side of things as well. You've worked your entire life to acquire these assets, the assets that you have, the property that you have, and you have a diagnosis on record. And even though records are protected through research, and it takes a lot more to subpoena records and so forth, it's out there that you were in a clinical study, and it could come to light as to whether you should really have been driving with that diagnosis. And in this day and age with litigation, it's scary. And so you know, a lot of patients will make that decision on their own and some won't, and we have to go the way of driving evaluation, and they have to be able to see objectively that I did a behind the wheel evaluation and these were the observations.
Right.
And sometimes even that's not enough.
Yeah.
We had a guest on from FAU, and she did a driving study for seniors, just watching how they drive, watching their skills. So sometimes, you know, they'll want to go through that too. But that brings me to a point that we had talked about during the commercial. So you go to the study, you find out that you've got the gene. How does that affect your insurance down the road? How does that affect now what you choose to do with the rest of your life? Because with knowledge comes responsibility.
And is it
now you know it, you
different-
got to be honest.
And is it different if you get diagnosed through a study versus getting diagnosed through a private neurologist?
So I don't know the private neurologist
Right.
component of it, because as far as I know, you don't have to report that, but then we were talking during commercial break
Right.
and you thought maybe differently. But as far as research goes, and it might be the same for both, there is a federal act called GINA. And GINA is an act that basically protects you from discrimination from employers as
What
well
does
as
it
health
stand
insurance
for?
companies. It's a Genetic Information Non-Disclosure Act.
Okay.
And basically that protects you from health insurance companies and employers discriminating against you. But
But if you go then for health insurance and it says, do you have any whatever? See, there's my
Pre-existing.
tongue-tied
Right,
tip of the
exactly.
tongue mess.
Pre-existing condition.
Should you put on there, I have the gene for dementia?
well, you have to honestly disclose,
I
but
know.
they can't be discriminating against you based off of that.
Okay.
But I know people that have had issues getting health insurance because they have sleep apnea and they wear a CPAP.
Oh.
So why would that be I wonder, and we probably don't have the answer to that. I don't know if you do, but why would that be different?
But so if you're referring to long-term disability, that's a whole nother can of
Oh,
worms.
okay, so maybe
and
we're
that it
talking
might be
something
long-term disability. I know that
Okay.
they look at different diagnoses and they kind of weigh those.
Right.
And again, that's where I don't know long-term care nowadays.
Right.
They may be very specific with their questioning, and they may ask you to declare that.
Right.
So
So it's good to go to the study, but then be prepared, because with knowledge comes responsibility, and then you might have to
you might have to disclose that.
disclose
Yeah.
that. Yeah.
So much to consider.
So much to consider. And I'm sure you see just different things all day long, every day.
All day. There's never a dull moment
I
at
bet.
Brain Matters
I
Research.
bet.
We say, hey,
Every day is different.
every
What
day
would
is
you say
different.
is the number one thing, though, that people should be thinking about, regardless of their age, to gear toward the direction of making sure that their brain is doing what it's supposed to be doing?
What can we do proactively?
Well, proactively, I'd say the most important thing is keeping your brain stimulated. And I even say, even once you have the disease as well. So I call it my SIP, 3 different modes of stimulation. S stands for social stimulation, active socialization. Ideally, it could be through a book club, it could be active conversation. And then I stands for intellectual stimulation. And that's not just puzzles and Sudoku for everybody.
Right.
It's what drives your brain. So some people like to work with their hands, and they should be doing building activities. I don't know, building Legos or building a birdhouse. Some people really work with the mind and like to do puzzles and things. Again, the book club and so forth. Different people are stimulated in different ways. But I think also along with that goes before you develop disease symptoms is to
Yeah.
try to learn new things, because you build up your cognitive reserve that way, so that if or when things happen in terms of a pathology, at least you have some bank to rely on.
Right.
And you're able to compensate for a longer period of time. And then P, I didn't forget, P stands for physical. Physical activity could be anything that really gets you going. And I always say to my patients, cardiovascular recommendations, American Heart Association recommends, I believe, 130 minutes a week, 5 days a week of 30 minutes of aerobic exercise. But if I tell most people that, they're going to say, oh, heck no.
Right.
So I always say, come up with a reasonable goal. And if you're doing it and if you're feeling good doing it, you're probably going to increase up to that anyways. But do something, get your body moving.
Right.
And actually for this population, I believe the most recent recommendations are not only aerobic exercise, but also weight strengthening
Oh, right.
and resistance training.
Right.
But then also even maybe a day a week of some exercises that involve just coordination, gait
Because
and
they say
balance
muscle
training.
mass too. Muscle mass also has something to do with the amount of,
Yeah.
your BMI and your muscle mass. All of that is going to keep you
Yeah.
to have a healthy brain or not a healthy brain. And I remember looking at a video of two brains. It was 2 men that weighed exactly the same size. They had the same size head, they died at the same age. One died with a healthy brain, which looked like a healthy brain, and the other one died with dementia. And it was literally shriveled up and a darker color, and it's, yes. And so what they said is, too bad you can't see that that's what's going on in somebody's head, because then it would make sense that they're talking that way or that they're acting that way. You can't see it. You can't see it like you can see other things.
Yeah.
So it's sad. For a very long time, like you say, if it can start 15 to 20 years, you're dealing with your parent or your loved one in a different way, being aggravated with them and agitated, when really they can't help it. That's all they know. That's what their brain's telling them to do.
And that's often, I think, one of the hardest things for caregivers is that there's nothing you can do about it, right? So there are drugs that might
slow it down,
you know, but
it's not going to cure it.
It's not going to cure it, and we can't, some of these behaviors they can't control, right? So we just said it's cognitive, it's memory, right? So when someone with Alzheimer's or another form of dementia asks you the same question 15 times in 2 minutes, we want to get frustrated with them, right? They've asked me this 15 times. I've told them 15 times, we're leaving at 2 o'clock, we're leaving at 2 o'clock, we're leaving at 2 o'clock. But they can't help it. It's not them.
They can't retain it.
And I have to explain that a lot to my dad, who gets frustrated.
Who gets frustrated and wants to get out of the house.
Because my mom doesn't understand.
Right.
My mom doesn't remember that he's answered that question.
And so you talked about drugs. So what are some drugs then that are something that you would recommend? Or even some of the newer ones that are out right now. What's your thought on those?
So actually there are 2 different drugs that have been approved as disease-modifying treatments. So those are treatments that either stabilize or reduce the rate of decline of cognitive functional abilities. So those drugs are aducanumab, otherwise known as Aduhelm, and lecanemab, otherwise known as Leqembi. So Leqembi was just approved earlier this year.
Right.
Both were drugs that were collaborated on by Biogen and Eisai. Both drugs, unfortunately, because of what they do, they work to clear amyloid plaque in the brain. So they do come with a different type of side effect profile that you may be used to with other drugs. So there is a risk of swelling, there is a risk of microbleeds. But the good news is most of those side effects are asymptomatic. So we do safety surveillance MRIs regularly, and that's why, though these treatments are being offered commercially, I still say that research is the best place to be exposed to these drugs, because up until now, research centers were the only places that were working with these drugs. So that means that they're best equipped to manage the side effects. Not only that, but we are able to do cognitive assessments at key time points, usually at least once every 6 months, to be able to see how you're doing and how you're responding to the treatment. That doesn't always go with commercial treatment, and so those are 2 of the drugs that are available. And then, of course, we are investigating all kinds of drugs through research. And then I have to also add, too, that we also have device studies. So we have a really cool device right now that stimulates the brain with both auditory and visual stimulation. You do this treatment for about 60 minutes a day, and you wear this device that almost looks like a virtual simulator device, sunglasses
over your
attached,
ears and everything. Oh,
and we
interesting.
basically activate your brain activity to a certain wavelength, the gamma wavelength. And in studies so far and data that's been released, this has led to reduced atrophy in the brain.
Wow.
Whole brain
I had not
atrophy.
heard about.
I never heard of that either.
That I had not heard about.
And so it doesn't have to be one of these big bad drugs that can come with side
Right.
effects. These types of device studies are great for people who have allergies to medications and are sensitive to medications, or say, look, I want to introduce some possible benefit. I want some diagnostic clarification, which you get through a blood test or tau in the beginning. And if I qualify, I can do a treatment, and it's kind of low risk. You know, most common side effect is headache or tinnitus, and even that's not that common.
Yeah. So anybody then can they can call up and make an appointment and do the, what's the name of the study again?
It's called a No in 90 program.
No in 90.
So that means
So you don't have to qualify for that. Like I can
No.
call and go there and do the No in 90.
Yeah, so we start off with a free telephone screen, and then as long as you're open to the prospect of treatment through research, we bring you in. You provide medical history to the staff member taking your intake. And then ideally, in most cases, I'm able to see the patient personally. Otherwise, we have a medical provider team. That team will see you, and then staff share that information with myself and see what the best treatment options are. And it's not always research.
Right.
Though we don't see patients privately, we do have some private neurologists in the area that we have a great relationship with. And research isn't for everybody. And sometimes research just isn't for you at that particular time point. So we were talking during the commercial break about a younger patient, And, I said in that case, I don't think it's the best thing to do to come directly to research. You're 53,
Right,
you haven't had any
right.
kind of workup. There might be a fixable cause for cognitive impairment that
Right.
we're missing.
Which we had talked about thyroid.
Yes. Yep. So we've got to do what's best
Yeah.
for each patient
Right.
individually, and
Right.
it's not always research.
It's not always research. So I have a question. So if someone comes to you and they go through the workup and they're not necessarily a candidate for the research study, but maybe they have the APOE or maybe they have a family history and they want to try one of these drugs that could stave it off, would they then go to see a external neurologist, or is that something you do?
So we have,
Or is that even possible? I mean, can you get those drugs at a neurologist?
Yeah, so actually the Leqembi that we just mentioned that was approved earlier this year, unfortunately it's not we're not recruiting any active patients for that drug for clinical Alzheimer's disease, so for mild cognitive impairment or mild dementia. But we do have a prevention study with that same drug. So, studies are starting to show that early intervention, I think, no matter whether you believe in the amyloid theory, the tau theory, or the inflammatory theory, early intervention is the best way to go. Those patients have a better prognosis, and I will say anecdotally, I've noticed the same thing.
That it would stall it.
The prevention study is to either prevent onset of symptoms or delay onset of symptoms. So if I could keep you in the preclinical stage, or even eventually, even if you progress to MCI, keep you in the mild cognitive impairment stage for a longer period of time, the whole goal is to keep you functional independently
Right.
as long as possible. And so I guess my takeaway point would be, don't be afraid. I know it's not for everybody, but having an answer early on can actually keep you functional independently for a longer period of time.
And it'll keep your mind focused on, like, I get up in the morning, I'm thinking, oh, I hope it's raining because I don't want to walk.
Right.
Oh, I hope
But
that
if
the
you
weather's
knew
horrible.
that
But
it
if
was
I
gonna
knew
help-
I had that in me, I'd say, I'm putting my shoes on.
Right.
I mean, I should just think that I have it in me, and then it would make me get up and walk in the morning. But you're right. Choosing what you eat, choosing what you drink, choosing your exercise.
There's so little we can control.
Right.
I believe that we need to control what we can, because there's so much, like the genetic part of it,
Yes.
that we have no control
Yes,
over.
and it's programs like this that help get your message out. It helps get the caregivers that are listening in right now or viewing right now to give them something to think about. And again,
And resources.
And resources. And again, our support group, I think, is phenomenal. And it is this Thursday at
3 o'clock
3 o'clock at
Allegro.
Allegro on Hagen Ranch.
in Boynton Beach.
And it's just a very successful group of people, loving people that are dealing with the struggles of being a caregiver, and they're completely burned out. We do offer respite care, so if you can't leave your loved one at home, be sure to bring them with you, because it's really a time that you need to get some time to yourself. You've got to have some time to
Get
be
out
heard
what you're
and
going
be heard.
through.
Right.
Maybe get some helpful hints or some tips on how
Yes.
you can deal with the challenges that you're going through as a caregiver. And most importantly, we just want you to know you're not alone. And if there is something going on, and we can be a resource for that.
Yeah, and sometimes your story and what you're dealing with is going to be a solution to somebody else that's in that room. So they're going to bring up a problem that you're going to be able to help somebody else, and so just helping that person is going to make you feel better too. Support groups are great. I'm sure even with your studies, you probably have support groups, because I bet a lot of people fall apart when they realize that this is where they're headed.
Yeah.
And so now they have to find a group to be heard and supported.
That was the hardest thing for my mom when she got the diagnosis, because she had cared for her mother.
Oh.
So she kind of
Knew where she was
what
headed.
to take care of. Scariest part at the beginning.
And so you, I'm sure, suggest the same, that once they know
Always.
that they have somebody to talk to, or they go to a support group, and they immediately start getting tools to
Always.
handle this.
Yeah, I mean, that's the most important thing. It's not only just offering disease-modifying treatments, but it's offering caregiver support.
Yes.
And that comes in so many different forms. I think group support is great. It's not for everybody,
Right.
unfortunately. So we've got individual therapists in the area that we recommend patients to. I'll personally, sometimes in crisis situations, I'll coordinate care myself and call the right people
Aw.
and, refer to day programs.
Right.
I'm a firm believer. It takes a tribe, truly.
Yep.
It does.
Yeah.
Because now you're dealing with the person that you've just told they're going to end up with it, and now you're dealing with their spouse or their child. So it's two different things that you're battling. You're battling the
Yeah.
person now realizing what's going to happen, and now the person that's got to care for them. So
Yep.
I commend you. I think what you do is great. We're
Thank
super
you.
excited that we can have you on the show.
Yes,
you.
thank you so much for being here today.
And
thank
we
you
really hope you get a
for
lot of phone
sharing.
calls, because you will from us, and
Yes.
that will be one of our shows that she and I will go through that study, because I think it's great. I think it's good to show to not be afraid and to be prepared for what you need to
Yep.
do.
Yep.
So we sure appreciate having you. Again, you're one of our perfect examples of why we have this program.
Thank you
Thank
so much
you
for having
so
me.
much for being here.
you.
And for those of you out there listening or watching, again, please know that if you are going through this caregiver journey, you are not alone. If you need a resource, please feel free to reach out to us. You can email us at seniorstrategies.pb@gmail.com. You can reach out via our Facebook page, our Instagram, our YouTube. We're all over the place. So please don't feel embarrassed or worried about reaching out. That's what we're here for. You can attend our support group. As
Yeah.
we said, that's Thursday at 3 at Allegro in Boynton Beach.
And you can also call us at 561-800-6654, and we can give you any referrals or resources or anything that you're looking for. We're here to help you, because we know this is a tough journey.
And if you're dealing with a challenge or an issue that we haven't touched upon yet in one of our episodes, please let us know that too. Or if you know of a resource that we haven't highlighted yet, please let us know that as well, because we'd love to bring that to our viewers.
Right. And so we have another great show coming up, and we hope that you
Will join us.
have a great night.
Have a great night. See you soon.
Thank you for joining us today on Senior Strategies. We hope that you found the tools and the strategies that we offered you beneficial for your journey as a caregiver. We want you to leave today feeling empowered and supported.
Please follow us on Instagram, Facebook, and YouTube for upcoming shows and events. For more information, to schedule a consultation, or to join a support group, please contact us at 561-800-6654.
And remember the strategies
And tools you can use
to make your journey easier.